Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please leave your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order, and this is quite convenient for the study. I hope you will make use of it. Thank you very much. My dear friends, we have been discussing about uh, certain tips for clinical practice of Ayurveda pediatrics. Already we have covered two parts. So today is another important aspect, that is why can't we start a well child clinic. See, there is two concepts. There are two concepts. Number one is sick child clinic and another one is well child clinic. Presently what we are seeing or running is basically a sick child clinic, in the sense the child is getting sick, then the parents are bringing the child to the clinic and we are treating them the medications. So this is the concept of sick child clinic. Now, why can't we shift ourselves to a well child clinic? The problem is, nowadays the parents are more worried. Definitely when their child is ill, they are very worried and they will come. But otherwise also, the parents are worried by the fact that whether my child is normal or not. Okay, whether my child growth and development is normal or not. Whether my child's intelligence is normal or not. Whether this particular behavior is normal or not. So they don't know which is normal, which is abnormal. So for this, they have to visit a doctor to get the solution or confirmation. Yes, your child is normal. So here we are not giving any medications. They are coming and counseling will be there, and then the parents are going back with the assurance that yes, their child is normal. If it is abnormal, yes, it is abnormal. Now, why can't we encash this particular part by starting a well child clinic? Your clinic is only for the well child. See, well child in the sense, many parents are there who want to make their children a all-rounder, what we say holistic development. So they want to develop a good personality of the baby, they want to develop good physical growth of the baby, mental growth of the baby, behavioral development of the baby, intelligence of the baby, good immunity in the baby, good nutrition to the baby. See, these are all the important aspects where the parents are very much bothered nowadays. Educated parents are very much bothered nowadays. So why can't you start a well child clinic where in your child you are only giving scope for these particular elements? Yes, you have got certain methods where the child's immunity can be increased. It includes medication and other things also. You have got certain methods of treatment for increasing the nutritional aspect or correcting the diet pattern and nutritional aspect of the child. Correction of the behavioral pattern and as well as the routine of the child. Correction of the sleep hygiene of the child. Correction of the mobile addiction of the child. Correction of the normal growth and development, checking the normal growth and development. Okay, method for increasing the immunity of the child, including Swarna Prashna. Okay, so this is a new scope. So where we have to start a well child clinic, you are not at all treating a child with a fever, child with diarrhea, child with vomiting. No, leave it. You are only akin to these particular points. And this is one of the best options, that is well child clinic. Even in the modern science also, the concept of well child clinic is now emerging. Before they encashing this particular part, we need, because well child clinic may be very, very suitable for Ayurveda, because our principles are prevention. Swasthasya swastharakshanam and aturasya vikara prashamanam. So we are giving more importance for the swasthasya swastharakshanam, preventive, prophylaxis aspects, prophylaxis. That is our main motto. And we have got this number of methods. Okay, number of methods of prevention of the disease rather than any other medical sciences. So this is our main plus point, strength. And what I mean to say is, why can't we use it? Yes, therefore we have to start a well child clinic. Nowadays what is happening is, everybody, the competitive world is there. The world is totally competitive. Everybody wants their kids, or everybody want to nurture their kids in such a way that they will be excellent in future. No matter whatever may be the intelligence level of the father and mother and genetic trait, but as a parent they want my child should be very intelligent. Okay, so why can't you plan a protocol for this and register the patients in your clinic from the beginning itself and plan accordingly? Okay, nowadays another important thing is most of the families are nuclear families, and although we have got number of channels for getting the knowledge, authentication of the knowledge is the biggest problem. We have got so many knowledge in the YouTube, knowledge is available from the Google also, but still parents are totally confused because it is not authenticated. Unless and until it is told by a doctor, well-known doctor, expert doctor, the parents are not in a position to believe it. Okay, so now what is happening is the families are becoming more and more nuclear. There is no elder or grandfather, grandmother is there in the home who can give advice for some of the small things. Now suppose if the baby is simply coughing, grandmother knows what to do. By 10 minutes it will be correct. The child has started with the hiccups. Give some water or give some other things, it will be corrected. Child is not passing the stool. Grandmother knows the method. But nowadays in the nuclear family, nobody is there to guide them. Therefore, what happens, for the small problems also they run to the clinic. So more than the disease, now the parents are coming to the clinic for non-medical problems. That means whether to say that this is normal or not. What happened to my child? For simple itching they are running. Okay. So child is having some slight movement in the night hour while sleeping, and parents come to a conclusion that this is an epilepsy. They will run to the clinic. Now your job is only to look into that, confirm it that this is not epilepsy, that's all. So this is the concept of well child clinic. Okay, why can't we develop these well child concepts? Whenever the patient comes, give some of our major acid drugs or brain stabilizing drugs for them and assure them this is nothing, this will be okay. Okay, if the same is repeated after some time again, then we'll go for some investigations. So this is how you can develop the well child clinic in your city. Okay, so they want a holistic now development of the child. Now only Ayurveda can provide the holistic development of the child. Okay, our concepts, if it's completely adopted. So we need to think on this well child clinic concepts. Okay, so desperately parents want to increase the immunity of their child. Desperately parents are there to increase the psychological stability of the child, competency of the child, skill development of the child, okay, concentration of the child, attention of the child. These are the core issues. Every mother wants this. Okay, so every mother, every parents want their child to become a genius. And why can't you employ the Ayurvedic methodology of nurturing the child to make him become a genius in future? And we need to prepare a protocol for this, and this should be applied, and this will be the concept of well child clinic. It may be in terms of nutrition, immunity, psychological, developmental problems, normal growth and development, okay, some of the behavioral problems, behavioral issues. Okay, so these are the core issues. Nowadays a child is in the 15th year, but he don't know the social communication. He's completely away from social communication. He's confined to the mobile or confined to his room. He don't want any social communication, and for the parents this is the biggest issue. So why can't you address this problem? You will be famous within few days. So this is the concept of well child clinic that we can employ. Now in the next class again we shall see some of the very important aspects related to tips in Kamalmritya pediatric practice. Thank you very much.